after legs?
No, doctor.
Okay. Can you score this cramp pain from 0 to 10? And which 10 is
Almost, doctor. Doctor, it's like say maybe four.
okay? Four. Mr. Ali, anything make it worse?
Doctor, just when I'm sleeping, when I'm sitting, it is making difficult.
Okay. And uh, anything make it better?
Doctor, when I'm walking,
Okay, Mr. Ali. Uh, Mr. Ali, can you tell me about you have any surgery before?
no,
Any
doctor.
surgery? Okay. And do you have any long-standing medical illness
Like what, doctor?
like high blood pressures?
No, doctor. I have high blood pressure, but under control with my diets.
Okay. Any history of leg swelling you have before?
No, doctor.
Okay. Uh, any high blood sugar?
No, doctor.
Okay, Mr. Ali. So, Mr. Ali, is this pain? Okay. Uh, Mr. Ali, any member of your family has same condition like you have?
Doctor, my mother used to have this kind of, feeling like, say, some fidgy feelings, but she never had any some sort of proper diagnosis.
Mm-hmm. Okay. And are you using any medicine regularly?
No, doctor, I'm not using anything.
Okay, Mr. Ali. So, Mr. Ali, any bleeding history you have?
No, doctor.
Okay. Mr. Ali, what do you do for a living?
Doctor, I'm a crane operator.
Okay, crane operator. How is your job going on?
Doctor, it's just really stressful. I can't sit because I'm working on heights, and it is really difficult for me to sit for longer time on one place. My job is really sensitive, doctor, so it needs more
Mm,
attention.
okay. With whom you are living in home?
Living with my wife and kids.
Is everything okay in home?
Yeah, yeah, doctor, everything is fine.
Okay. Do you smoke, Mr. Ali?
Yes, I do.
Do you drink alcohol?
Yes, doctor.
Mm-hmm. How many cigarettes you are taking? You are
Doctor, I'm
smoking?
taking 10 to 20 cigarettes daily for almost 15 years now, doctor.
Okay, Mr. Ali, smoking is very hazardous for your health, not good for your health. I will give you a leaflets in which everything will be mentioned, okay, regarding the bad
Yeah.
side effects of smoking,
Mhm.
okay? And when you decide to quit the smoking, we will arrange another session for you, okay?
Sure, doctor.
Okay. And Mr. Ali, what can do you exercise, Mr. Ali?
Doctor, I'm not getting time.
Mm-hmm. What about your diet? Can you tell me what kind of food you are taking?
Doctor, I'm taking everything homemade.
Okay, Mr. Ali. Can you tell me about your BMI you check?
Doctor, my BMI is 32.
32. Okay. And okay, Mr. Ali. Mr. Ali, so what you think? What may be the reason of your this leg cramps?
Doctor, maybe I have some circulation problem, maybe some nerve issue.
Mm-hmm. And any particular worries in your mind?
I was reading, it says that maybe it will end up with as a Parkinson's disease or some serious nerve disease, serious nerve problem.
Mm-hmm. Okay, Mr. Ali. Hope it will not be like that. And how can I help you regarding this consultation?
I hope that you will name this diagnosis. Do you tell me that what is this diagnosis, doctor? And
Yeah, sure. I will.
I need some practical help so I can sleep, doctor. My sleep is really disturbed.
Okay, Mr. Ali, we'll talk about this. Mr. Ali, please tell me how this affect your daily life?
Doctor, as I told you that I'm working as a crane operator, so I can't sit on one place, and my job is really sensitive.
Okay, Mr. Ali. Mr. Ali, can I examine you?
Sure, doctor, go ahead.
Yes, I will check your pulse, blood pressures, and then I will inspect your skin of your legs. Okay.
Mm.
Uh,
Mm.
oh, sorry, I forgot to ask. Is it in your both legs? Yeah.
Yes, doctor.
Okay. So I will check the skin of your legs. Then I will touch your legs. Okay, for any scar, for any edema. Okay, and
Mm.
then
Mm.
uh, I will examine whole examine of your both legs.
Sure, doctor.
Okay, Mr.
Examination normal.
Examination what?
Normal.
Okay, Mr. Ali. So, Mr. Ali, from taking history and examination, I think you have a condition which is called varicose veins.
Oh, is it, doctor?
Yes. Have any idea about this?
No, doctor.
Yes, Mr. Ali, this is a condition in which the blood pipes are twisted and blood are pulled into them because blood pipes have valves in the legs, yeah, and
Uh-huh.
they bring bloods to back to the hearts.
Okay.
Okay, so because this condition occur, maybe the weakness or maybe the some weakness or damage to your walls. Okay.
Mm-hmm.
Uh,
Okay, doctor.
Yes, so for this, I will give you to take exercise, okay? Do
Mm.
support stocking, okay? We are stocking
Mm.
and uh, then do some exercise. And for your pain, I will give you paracetamol, okay?
Okay.
Have you used
Uh,
paracetamol before?
no, doctor. I'm using this Brufen tablet, doctor. Sometime when I'm getting headache, but okay. It will be okay for me, doctor.
Yeah, I will give you paracetamol and you can use it 3 times per day, okay? And do some
Mm.
exercise, try to reduce your weight. And when you are sitting, please try to elevate your legs, okay?
Okay,
And
doctor.
also, there is one exercise program, yeah. I will do this is the one program in which they will reduce the you have to go for the date program. They will reduce you have to do special exercise for this legs cramps, okay,
Mm.
and they will reduce the intensity of this cramps, okay.
Mm-hmm.
Yes, and in case in any condition in any case you feel uncomfortable or there is bleeding, you can come and
Mm.
visit me again. Sorry,
Okay,
this
doctor.
yes. Sorry, Doctor Man. This case today I didn't prepare, but other case I prepared DVT and pulmonary embolism and other I prepared. Only this I didn't prepare.
Okay, what do you think, Doctor Ruhullah? Any idea? Any idea,
This
doctor?
was varicose vein, yeah,
Okay, why varicose vein, Doctor Ruhullah?
because you was telling about the link cramps, no? And for
Yes,
six
okay.
months, yeah.
Okay. Examination was normal, no, doctor?
Mhm. Examination. This
Okay,
was,
when
I think,
examination,
restless leg syndrome. Yeah, I think.
yes, doctor. It is a restless leg syndrome. Why? It is like this for everyone. Doctor, first of all, you have to see that uh, when you're looking at the patient, he is having a sedentary lost lifestyle. He's working on the crane maybe 12 hours, whatever, so on. He's getting the pain once in the evening when he sit on the sofa, once in the bed
Mhm.
at night when he trying to sleep, often wakes in the night with the same sensation. So you have to ask about the timing. Second thing, you have to ask about relieving and aggravative factors. Patient when he get he say that whenever he get a movement, he get helps. Okay, when he have to wake up in the night time, he have to walk around. Or you have to ask him when you're getting the night time this problem, how you get relief. Okay, then patient will say, Doctor, I have to walk around my room, so I feel that pain reduction and pacing reduces the sensation of temporarily, and after that, as soon as he lies back or sit still, it comes back. Okay, sitting still for long period, like say a long car journey, flights, cinema, whatever, so on, you have to ask about. And patient will be having laterality. Varicose vein, do you think that it will come with bilateral? Sometimes, yes, bilateral, it can be possible. Okay, but patient will be having different sensation. Okay, for patient will be coming with bulging something, itching sensation. Okay, patient having creeping, but it improves with walking. Varicose vein, do you think it will improve with the walking? Okay, then
Mm.
uncomfortable rather than truly painful. Okay, having patient having creepy sensation. Okay, and it is impacting his life. And somehow he said that his mother also had the same thing. So now when he say that his mother having same thing, so it means this can be from family history again. And the medication, he's not taking anything, but he's taking alcohol and everything. The patient having idea that this the circulation problem one. Number two, he's having worried about Parkinson's disease. Third thing, he's expecting to name the diagnosis. Okay, and he wanted to get some sort of relief from you. Examination was mostly it will be normal. But Mr. Khan, as your examination is normal, so I wanted to rule out further. I need to run few investigations. Here, you have to tell what investigation you're going to run, doctor. I'll be checking your full blood count. I will be checking your ferritin, urea electrolyte, the thyroid profile or TSH, glucose. Okay, everything will be normal except his low ferritin will be there. Okay, this is a key reversible factor for restless leg syndrome. Okay, so
Okay.
diagnosis of feature supporting for this restless diagnosis, urge to move. When you're talking about this restless leg syndrome, you have to see that patient having urge to move legs accompanied by uncomfortable sensation. One. Number two, symptoms begin or worsen during rest or inactivity. Number three, symptoms relieved by movement. Number four, symptoms worse in the evening or night. No other explanation, like say normal neurology will be there, no radicular, no neuropathy sign will be there. Okay, family history and low ferritins are supportive diagnosis, supportive for the diagnosis. Okay, so working diagnosis, you can say, Doctor, I'm Mr. Khan. I'm suspecting that you are suffering from the condition we call it restless leg syndrome. So for as per the GP level, as per in the exam, so you can say that this disease call it restless leg syndrome. Okay. So we have to explain that this is a neurological sensory motor condition, not poor circulation, and or something in the head. It is not from your brain. Okay, common, especially in the middle age, and often runs in the families. Okay, symptoms are
Okay.
due to altered dopamine pathway into the brain and often worsened by the low iron. Okay, now in simple word, how you get to explain what you're describing? What you're describing fits very closely with a condition called restless leg syndrome. It causes unpleasant, restless sensation in the legs when you are resting. Okay, especially in the evening and the night. It improves when you move around. Your examination is normal, Mr. Khan, and your blood tests show that you having your iron stores are low. Okay, which are common contributor to this condition. Are you getting it, Mr. Khan? Okay, reassure. Are you thinking about Mr. Khan? This is like a Parkinson's disease, as you had heard or you read on that some internet. It is not. It is not a sign of your nerves dying. So we have to reassure the patient. Second thing, address reversible factors and investigation. Because your ferritin is low, Mr. Khan, investigation. So you are going to run this investigation as I told you. And if patient having anemia or low ferritin unexplained, so then you can go further a little bit. We call it Select screen and the GI workup as per age and symptoms profile. Okay. So our aim to raise the ferritin within normal range. Many guidelines suggest aiming more than 75. This patient have only 50. Okay. So
Yeah.
now first line is non-pharmacological management. Okay, we have to discuss, Mr. Khan, about your. Shall we discuss about your non-pharmacological plans where medicine will not be involved? First of all, we'll be talking about sleep hygiene. Okay, and you have to keep your regular sleep and wake up times. Okay, screen-free, screen-free and wind down before the bed. Okay, so you have to, if like say patient is using screen, so you have to ask about screen, and cool and dark bedroom must be
Yeah.
there. Avoid staying
Reduce
in the bed.
reduce amount of caffeine also.
Yes, exactly. Avoid staying in the bed awake for long periods. Okay, then let's talk about lifestyle factors. Reduce or eliminate evening caffeine. Okay, limit or avoid alcohol if patient is taking alcohol. Stop smoking if applicable. Okay, gentle daily exercise, avoiding very vigorous exercise right before the bed. Okay, and now leg specific measures are there. Okay, leg stretches before bed. One. Number two, this is the examiner want to listen from you. Okay, and the gentle massage, warm bath or hot or cold packs on the calf. Okay, getting out of the bed briefly to stretch out a walk where symptoms flare, like say instead of endlessly tossing or turning kind of stuff. Okay, because many people having habit, they will be putting they will turning their leg and tossing around. So you have to say that you should avoid this thing. Okay, and
So also, there is
uh,
one tablet, Dr. Imran, we are giving tablet Rolizol, yeah?
I will come on that one, Dr. Ruhula. Then review medication. If patient is taking any medication, avoid or minimize drug that can worsen restless leg syndrome where possible. For example, some antihistamines are there, certain antidepressants and antipsychotic drugs are there, dopamine antagonists are there. So we have to modify or we have to change the dose or minimize the thing. Okay. In his case, his current drugs only, he was not taking any drugs. So, for example, if he's taking Brufen or something, it was not applicable here. Now we are going to correct the iron deficiency. This is another main important task here. So here we have to tell the patient that, okay, I'm going to start, Mr. Khan, I'm going to start your oral supply iron supplementation, like the ferrous sulfate tablet. You have to tell how you're going to take it as per the local guidelines again, and discuss the don't take on empty stomach, or sorry, take on empty stomach or with vitamin C if tolerated. Okay, common side effects: GI upset and constipation and dark stools. And we are going to recheck your full blood count and ferritin after a few months. Are you getting me? So explaining that improving iron levels can sustainably reduce or even resolve your restless leg syndrome symptoms in some in your case. Okay, and it might take several weeks or months to see full benefit. Are you getting me, Mr. Khan? So, like say for example, if symptoms are frequent or significantly impairing his sleep, despite optimizing iron. First of all, we are going to see patient having a low iron, a low ferritin. So we are going to optimize and lifestyle management. But still, if patient say, doctor, after taking this one also, I'm not getting, then we have to start dopamine agonist, like say Prampixol or ropinirole and rogesterone, whatever so on, or alpha 2 delta, what do you call it, like say gabapentin or pregabalin, you can say. But at our level, at our GP level, so you have to acknowledge this that the medication is an option if the symptoms remain troublesome. Here you are going to say that first one, we are going to maintain your problem with simple measures, okay? And you have to follow. Do not choose an exact drug, but you can say, Doctor Rohula,
Okay.
after we correct your iron and work on lifestyle and sleep measures, if you are still having frequent or disabling symptoms, we can consider some specific medication that affects your symptom, what you system, what you call it, dopamine system, and a nerve pathway to reduce the restless legs symptoms. Okay, this medication can help, but they're having their own side effects. So if like say you are able to say you are saying that one, then you have to tell the side effect. So better to don't use exact drug name. Okay, otherwise patient will say, doctor, what is the side effect? Okay.
Okay. Okay,
Yes,
doctor.
okay, yes, and follow up again. This problem will last longer, more than 3 months. Okay, we will be checking your iron level after 3 months, and we are going to see you after 6 to 8 weeks. Okay, and safety netting you can say, and you can go ahead. Okay, for a simple way, just in a bullet style or whatever you say that for your remembrance. First of all, we have to say the history. In the history, a patient will be having urge to move legs, worse at rest, better with the movement, worse in the evening or night. Okay, first we have to rule out peripheral neuropathy, radiculopathy, or vascular disease. Ask about sleep, alcohol, caffeine, medication, and family history. Examination, neurological examination will be there. There will be no vascular or spinal red flags. Okay, this is a typical feature of restless leg syndrome. Okay, then investigations. If we are going to check that any iron stores, patient will be having low ferritin, and we will be talking about if patient is elderly, then we have to see about any other factorial causes like say age more than 60, patient having low ferritin. This is a red flag again. Okay, so we are going to refer this patient to the specialist. Okay, and we are going to correctly label the diagnosis as a restless leg syndrome. Okay, in this patient, this patient
Oh,
is a middle-aged patient.
yeah. Actually, I was thinking according to the task you will asking another questions, so I prepared the task, and that is why.
It's okay, doctor. It's okay. Um, doctor, that was.
Okay, thank you, Dr. Imran. Thank you.
Thank you. Welcome. Who else is going for the exam, doctor? Dr. Sadaf is there.
Yes, Dr. Imran.
Okay, Dr. Sadaf, your case. Okay, your case is 58 years old. Daniel Khan. Come to discuss his problem with you. Take proper history and examination with management. Okay, start.
Good evening, Mr. Danyal. My name is Dr. Sadaf. How may I help you?
Doctor, my voice has been worse for weeks and now it's not getting better.
Okay, can you tell me more about it?
Doctor, my voice is hoarse and rough almost now about 8 weeks now. Actually, it started after heavy cold, but cough and other symptoms was settled. But voice didn't come return didn't return to back to normal, doctor.
All right, sorry to know about that, Mr. Danyal. Since how long have you been having this problem?
Doctor, it's been 8 weeks now.
Okay, can you tell me how it started?
Doctor, as I told you that I had a cold and cough before that symptom, before this hoarseness started. It settled, but my voice is still the same. That in the like my illness, and now I'm feeling that I have raspy and some breaks, and need to clear my throat oftenly.
All right, Mr. Danyal, I need to know something more about your problem. Is it okay if I ask you a few questions?
Sure, doctor.
All right. So, did you take any medication for your problem till now?
No, doctor. I'm just taking this lozenges, and I'm clearing up my voice. But again, I have to take a lot of time to do this thing.
All right. Is this the first time that you're having this kind of a problem?
Yes, doctor.
Okay, and you told me that you had upper respiratory infection. So, was that treated?
Yes, doctor. I first treated doctor giving me this tablet levocetirizine. He given me some cough syrup, and there was paracetamol tablet.
All right. And any other symptoms that you might be having besides this?
Uh, no, doctor.
Okay. Do you feel that your nasal secretions are going at the back of the throat?
Uh, no, doctor.
Okay. Uh, when you lie down in bed, do you think that you have any heartburn?
Yes, I frequently am getting this heartburn. Mostly whenever I'm taking doctor heavy meal. I'm actually foodie person, doctor. I like spicy food and fatty food. Uh,
Okay.
I can't resist, doctor. So
Okay.
sometime I feel that this is some acid taste in my mouth.
And what about when you wake up in the morning? Is it still there?
Yes, doctor, I feel bitterness in my mouth.
Okay. Do you have any cough?
Mild cough, dry cough, mostly because of this
Mm-hmm.
cold.
Okay. Any tummy pain?
No, doctor.
Okay. And is this cough dry or wet?
It's a dry cough.
All right. And you don't have any fever with this, right?
No, doctor.
Okay. Mr. Daniel, do you have any other medical illness?
Like
Any
what,
high blood,
doctor?
any high blood sugars?
Uh, no, doctor. I'm having high blood pressure, but I'm taking this tablet, amlodipine, but not regularly, doctor.
Okay. And when was the last time you checked your blood pressure?
Doctor, just now your staff nurse checked my blood pressure. It was almost 155 by 96.
All right. Okay. Mr. Daniel, do you have any chest pain ever?
No, doctor, this heartburn is there. That's it, doctor.
Okay. Any blurring of vision?
No, doctor.
Any frothy urine?
No, doctor.
Okay. And since how long are you taking amlodipine?
Doctor, it's been 10 years now.
All right. And do you have any family history of any illness?
Like what, doctor?
Any high blood pressure or any heart disease in the family?
Uh, yes, doctor. In my family, there is a problem. They call it varicose vein, doctor.
Okay. All right. So, Mr. Daniel, what do you do for a living?
Doctor, I'm a salesperson.
Mm-hmm. And how are things at work?
Work is nowadays really crazy because I have to talk a lot, but unfortunately I can't make it because my voice not helping me.
Mm-hmm. Okay. So, Mr. Daniel, who lives with you at home?
Doctor, I'm living with my wife.
Okay. And everything is okay at home?
Yes, doctor, everything is fine.
Okay. And what is your diet like? Like you told me you're a foodie person.
Mhm.
And so you take home cooked food or outside food?
Doctor, I am taking most of the time outside because I have to spend my, lot of time at outside. I'm coming late night.
Mm-hmm. Okay. And do you know your weight according to your height?
Doctor, my BMI is 37.
All right. Do you smoke, Mr. Daniel?
Yes, doctor, I do smoke.
How much?
Doctor, 10 cigarettes daily for 20 years.
Okay. Have you ever thought of quitting it?
Doctor, frankly speaking, my job is not allowing me to do it. Lot of stress.
Okay, I can see that. But Mr. Daniel, let me tell you, it's really hazardous for your health. So we can have another session on it if ever you think of quitting it. All right. And also, I'll
Sure,
be giving
doctor.
you a leaflet about the hazards of smoking. All right.
Sure, doctor.
Okay.
Mhm.
Okay, Mr. Daniel, what do you think about your condition?
Well, doctor, initially thought it was just cold, maybe due to some virus. But now I'm wondering something wrong with my vocal cords.
Mm-hmm. Okay, and that is what's worrying you?
Yes, doctor, it's really worrisome for me.
Okay, and how do you want me to help you?
Doctor, can you give me some sort of proper? Can you check me properly and you can give me some tablets, or maybe you can send me to ENT.
Okay, we'll talk about that, Mr. Daniel. And I can see this is really worrying and that is impacting you. Okay, so may I examine you?
Sure, doctor. What you want to examine?
Okay, in complete privacy and after sanitizing my hands, I would check your general physical examination. I would want to look at your throat and your nose, and I would listen to the four areas of your heart and check your lung bases and lower limb edema. And I would also like to
Hmm.
check the back of your eye. That's all.
Okay, examination not normal.
Okay, okay, Mr. Daniel, I need to offer you a few investigations. Would that be okay?
Okay, what you want to do, doctor?
As your blood pressure is also a bit high right now, and I would like to offer you a few baseline investigations like CBC
Mm,
and fasting blood sugar and urea creatinine electrolytes and kidney function, liver function test. Uh,
Normal.
so, okay. Okay, Mr. Danyal. So, I think the condition that you might be having is something that we called gastroesophageal reflux disease. Uh,
Okay,
and
doctor.
but also, yeah, as you are taking outside food and you are taking spicy food and more at night, so that might be causing you this heartburn that you're having, and that explains the cough and the hoarseness. So I would suggest you to can you try and lose some weight, as that might be contributing to your problem, as you are
Okay, doctor.
being higher than normal. So, and
Mm,
also you're smoking, so that also can aggravate your problem. Are you
okay,
getting me?
doctor. Okay, doctor.
All right. So I can give you a referral to a dietitian, and also we can start you on. Can you do some exercise for 30 minutes a week, a day, for 5 times a week? Can you try that?
Okay, doctor.
All right. And it's really important that you take your last meal 3 hours before going to bed. You can raise your head end of the bed and try to cut down
Mm-hmm.
on spicy foods.
Mm-hmm.
Right. And since you are having this hoarseness of voice since 8 weeks, so I would also want you to be seen by an ENT specialist.
When I can
Just
go,
hold.
doctor, ENT?
Uh, uh, First, I will give you these simple measures, but in 2 weeks' time, I can refer you to the ENT surgeon.
Okay, doctor. What they will do, doctor?
They'll just have a look at your vocal cords, and they might be ruling out anything serious.
Mm. Okay, doctor. You can't look at my vocal cords.
No, I want you to be seen by ENT surgeon, as I don't
Okay,
want to miss
doctor.
your appointment.
Okay, doctor. Time up. Dr. Sadaf, your last paragraph saved you actually. Otherwise, this case was gone actually. Okay, doctor. When patient having persistent hoarseness beyond 3 weeks with risk factors, okay, urgent 2 week referral. Okay. You know why? Let me explain you. Now you can see this patient is a 52 years old gentleman and he is having some sort of hoarseness voice almost 8 weeks now. Okay,
Mhm.
he's thinking might be because of his because of his viral infection, maybe because of his gastroesophageal reflux, he's having some problem. So no, here in the history, you must have asked about about voice usage. Okay, he talks a lot at work and spend hours on the phone and in meetings. Okay, he's overutilizing his vocal cords. He has been trying to push his voice to get heard in the noisy environment. So maybe him like say he's a hawkery kind of stuff. Okay. So past history, he's having long-standing gastroesophageal reflux. He's taking omeprazole 20 mg on on and off. Okay. And smoking, yes. Alcohol, yes. Occupation, he is having heavy voice use at work. Okay. So now there are some important risk factors for the laryngeal cancer. So these are the important risk factors for the laryngeal cancer. Okay. Now, red flag screening. Okay. Hemoptysis, you don't have otalgia. I means like the ear pain, don't have neck lumps. You haven't noticed breathing. You don't have any stridor or significant exertional dyspnea. Neurological, no weakness, no dysarthria, or no stroke in the history. Okay. Duration and previous episodes are they never had a hoarseness for the long time before. Long period, long before, and passed cold occasionally, but made voice husky for a few days, but always recovered, but this time it is not recovering. And this episode has now lasted more than 6 weeks. Okay,
Mhm.
examination absolutely will be normal. Here you can say that I cannot visualize your larynx directly in my surgery because this one should be that ENT will be looking with a flexible, tube or camera. Okay, nasoendoscopy. Okay, for now, you can see the work for this patient working different working diagnosis for the diagnosis and the differential. You can talk about benign vocal cord pathology, like say vocal cord or nodules, polyps, like say voice overuse. One thing. Second thing, laryngitis, post-viral or reflex related. Laryngeal cancer must always be considered in a smoker with a persistent hoarseness. Okay, one point. Number two, vocal cord palsy from nerve injury, thyroid, as you asked about, and lung apex or tumor, CNS pathology. Yes, it is not there. Hypothyroidism, functional dysphonia, and less commonly, like say amyloidosis or granulomatosis disease, whatever, so on. But in this scenario, doctor, there were few things are having some sort of, some ruling out some sort of laryngeal malignancy or significant laryngeal pathology might be. One is 8 weeks of hoarseness. Number two, smoker, alcohol, reflux, and heavy voice use. Okay, there is a no weight loss, but persistent and risk factors raises the concerns of laryngia. Okay, even the patient don't have any weight loss. Okay,
Mm-hmm.
now working view. So you can see that patient having persistent hoarseness in a smoker with reflux and heavy voice use. One needs urgent ENT referral on a suspected cancer pathway to exclude laryngeal cancer, even though benign causes remain possible.
Right.
Okay. Now, we have to complete the management plan at our level. So you can explain in a way, and you can say that, Mr. Khan, your hoarseness has been on for about 2 months now. And while it started with a cold, it is not settled back to the normal because your voice has stayed hoarse for this long. And you smoke also. You drink alcohol regularly. I'm a bit concerned that we must rule out something more serious problem with your vice box. Are you getting me, Mr. Khan? Okay, here you should not say that including possibility for the cancer or whatever so on, because you are not going to break the bad news over here. Okay, so to rule out further what's going on with you, I'm just going to refer you. Okay, so you can say most people with hoarseness like this do not have some serious illness, God forbid, cancer. But the right thing to arrange an urgent appointment with ENT specialist so they can examine your vocal cord directly with small camera. Are you getting me? Okay, so here, what was the key examination point was there? Again, I'm telling you guys that persistent hoarseness beyond 3 weeks with risk factors, urgent 2 week referral. This is the agenda of this case. Okay, now symptoms and contributory factor management. You can talk about smoking cessation, alcohol moderation, reflux management, can give the PPI, whatever, so on. Voice hygiene, how? Avoid shouting, prolong loud talking, rest wise as much as possible, keep well hydrated, avoid excessive throat clearing, avoid very dry or smoky environment. Okay. However, do not simply treat as a reflux or laryngitis in a review in the review in the months. Okay, because once hoarseness is persistent more than 3 weeks, doctor, with risk factors, referral should still go ahead as you did. Okay, now here, what was that? Why I given you passing? You given the diagnosis gastroesophageal reflux disease. Okay, you are unable to explain in a way that this might be suspecting, but still, this your case is a pass. Pass why? Because you referred this case.
Right. Because the red flag
Oh.
was there all along.
Yes, yes, doctor. That's the reason you save your case. Okay, well done. Dr. Ghulam Nabi. Dr. Ghulam Nabi, are you available?
Can I present case?
Sure, Dr. Kumar. But give me 1 second, doctor. I wanted to see because I wanted to see some rare candidates. Dr. Iram Qureshi is there. Dr. Iram, when
Yes,
is
sir.
your exam? Dr. Kumar, after this
13th.
I will give you, okay? Because Dr. Iram came earlier than you, okay? So I will
Done,
be
sir,
giving
done.
you, sure. Sure, okay, thank you.
Sir, I have one question, please.
Yes, doctor.
Did we order any blood test for this hoarseness of voice?
She ordered investigation, but everything will be normal.
So we have to order.
No need to order also, because like say on the basis you can refer also, because here red flags are prominent. So here if like say you are ordering blood investigation, it will be, again we call it overutilization of the resources.
Okay, thank
Okay,
you.
if you're ordering also, doctor, there is no harm. But if you're not ordering also, there is no such problem. Okay, so there's no such harm. Okay, so doctor, what is the name? Dr. Iram Qureshi, give me 1 minute, doctor.
Yes.
Okay, doctor, if like say if there is a examination having some picture, might not resemble, but it will be giving you same thing that whatever patient have. Okay. So,
Okay.
Dr. Iram, your patient is Mrs. Sarah Hussain. She is a 32 years old a female. Come to discuss her problem with you and take proper history and examination with management plan. Okay, doctor,
Okay.
start.
Hello, Miss Sarah. I'm Dr. Iram. How can I help you today?
Doctor, my hair's coming out and I'm really scared that I'm going bald.
Tell me more about that.
Doctor, I have noticed this my hair fading almost 3 to 4 months now, doctor. Hairs everywhere when I am showering, I'm brushing. My ponytail's tail feels thinner, doctor. My scalp is more visible along my, along my right side.
Okay. Does it start suddenly or gradually?
Doctor, it started actually, what I should say that it was a stressful period and I got some infection, serious infection of the COVID. I was hospitalized, doctor. After
Oh,
that, doctor, I started getting this problem.
okay. Did you pull out the hair? Do you have any habits?
You mean to say that I am pulling hair? Have a doctor, when I'm
Yes.
having stress, I do some sort of playing with my hair.
Okay. And do you bother by weather?
No, doctor.
Okay. As you said that you are recently admitted in hospital, what kind of disease you admitted for that?
Doctor, I had a COVID, severe COVID infection.
Okay. Okay. Do you have any more anxious than other people?
Yes, doctor, after this one, I'm feeling that I am more anxious now.
Okay. Do you have any itch on
Uh,
your scalp?
Doctor, I don't have any itch.
Okay. Do you have any dandruff?
You mean to say whitening? No, no, doctor, there is no scaling.
Okay. Do you have any joint pain?
No, doctor, I don't have any joint pain.
Any pitting of the nail?
Normal.
Do you tired all the time?
I feel tired, doctor.
Okay. Do you have any long standing illness?
Doctor, I've been diagnosed with doctor this problem. They say that I am having iron deficiency in the past, and I took iron tablet for a few months and then stopped.
Okay. Do you have any other problem other than iron deficiency?
Doctor,
Ye-
I have the acne problem and some
o-
facial hairs also there.
Okay. Do you have any similar problem running in your family?
No, doctor.
Okay. And do you have any rash on the body?
No, doctor.
Okay, Miss Sarah, what I asked few personal question. It's okay with you?
No, doctor.
When was your last period?
Doctor, it's through 3 weeks ago, doctor.
It is regular.
Yes, doctor.
Okay, are you sexually active?
Yes, doctor.
Do you have any blood in between periods?
No, doctor.
Okay, do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay, what do you do for living?
Doctor, I'm teacher.
Okay, how's the thing at work?
Stressful, doctor.
Okay, which kind of stress you have?
Doctor, school giving me warning, and I was admitted in a hospital. So they say that I was absent. They are not giving me salary.
Okay, it is really difficult to you. Okay, and what about your mood?
My mood is depressed, doctor, all the time. I'm thinking about how I will be running in the budget and how I'll be managing the utility bills.
Okay, Miss Sarah, do you have any idea what is running on?
I'm thinking maybe due to some of my stress and hormones, I'm losing my hairs.
Okay, Miss Sarah, what worries you most?
I don't want to become bald.
Okay, and what do you expect for me today consultation?
Doctor, I just want to know that what's going on with you. Can you do some blood test for me?
Okay, yes, of course. Miss Sarah, as you let's sum up, you have a loss of hair and you are worried about your baldness, and you have recently iron deficiency, anemia, and COVID, and you want to do some lab tests. It's okay with you?
Yes, doctor.
Anything else you want to add?
That's it,
Okay, Miss
doctor.
Sarah, I would like to examine you.
Okay, doctor. Check the group. I share the examination picture.
Okay. Okay. Uh, Miss Sarah, I would like to do some lab tests. It's okay with you?
Okay, doctor. Go ahead. What you want to do, doctor?
I would like to do complete blood counts and your thyroid function test, and also do the some hormonal profile FSH and LH
Anything else, doctor?
and serum testosterone level.
Anything else, doctor?
Mm. And no,
Anything else, doctor?
I would like to do your ANA profile.
Anything else, doctor?
Mm.
Doctor, I'm holding time for you.
Uh, and
Okay, doctor, I'll be giving you
what
doctor time.
else?
Full blood count shows low hemoglobin 11.2, ferritin is 12 microgram, it is low, TSH normal, and folate normal, B12 normal. Androgens mildly raised. That's it, doctor.
Okay. Miss Sarah, from your history examination and lab tests shows that you have an iron deficiency anemia. Because of
Hmm.
this, you have a loss of hair, and
Oh, doctor,
you are
because of
you have,
low iron problem, I have this
yes,
problem.
yes, it could be most probably you have this.
Hmm.
Meanwhile,
Okay.
Miss Sarah, I would like to advise you some medication which is known as iron supplement. You take twice daily. Uh, it will. You have any allergies to any medications?
No, doctor.
Okay. Sometimes it is tummy upset because of this iron supplement. You have an black stool, and sometime constipation, and sometime diarrhea. it would be better to take with the vitamin C. It improve the iron absorption. Are you
Okay,
with me?
doctor. Okay, doctor.
And if I would like to give you for 3 months, and you take it for 3 months, and follow up after 6 weeks with me with the repeat complete blood counts and ferritin level. If
Uh-huh.
you are not improved this condition and you still have a loss of hair, I would like to refer you to skin specialist. It's okay with you?
Okay, doctor.
Anything else you want to add him? Ask
That's it,
him.
doc. That's it, doctor.
Thank you, Miss Sarah.
Okay, doctor. Dr. Aram, we have 1 minute. Can you tell me one more diagnosis for this?
Alopecia areata
Doctor,
and
in beginning, you asked me one question. One question you asked the patient. You remember?
टेलो सर टेलोजिना एलोफ्लम कुछ इस तरह का है.
Yes, yes, that is the one, doctor. Wonderful. That is the diagnosis, doctor, because let me tell you why. This is a mixed diagnosis, okay? So, uh, patient having history of recent COVID with the stress ongoing. So, telogen effluvium, okay, triggered by the stress and any infection, recent infection with long hospitalization, persistent with diffuse shedding a few months after the trigger, okay? Hair after grows back once trigger removed and nutrients is restored. Okay, it can unmask the worsen pattern of maybe what you call it alopecia. But now in the differential doctor, there is one more thing what we call it female pattern hair loss. Okay, androgenetic alopecia. Okay, in that one patient will be getting progressive thinning over central scalp or and the crown. Okay, widening parting visible there, and family history in the mother will be common. Okay, there will be non-scarring. Now, important differentials to we have to consider to exclude largely from this case, which one is a alopecia areata. In alopecia areata, doctor will be getting patchy, well demarcated bald patches. Okay,
Mm.
and exclamation marks here will be there. Okay, here and there kind of stuff. And scarring alopecia will be having discoid lupus, lichen, what you call it, planopilaris paris with scarring and redness and scaling will be there in this patient don't have. Okay. Then one more is that which we call it trichotillomania, okay, which is a bizarre pattern of broken hairs, okay, thyroid disease and nutritional deficiency like say iron, low hair in this patient, but no other deficits are there. Okay, now in this case, we have a different management plan. So you can say that Mrs. Khan, that you're having non-scarring hair loss, which means hair follicles are still alive. So good news is that one. So there appear to be two overlapping issues you might be suffering. I'm suspecting you are suffering from two overlapping issues. One is a telogen effolium. Okay, do you have idea what's going on with you? No, doctor. Okay, Mrs. Khan, after a major stress or illness, more hairs than usual can go into resting phase and then shed a few months later. Okay, this fits with your COVID history as you told, and since your job stress is going on, the good news is that the telogen effluvium, the follicles are still healthy, and many hairs regrow over several months. And once things settle, and we correct the deficiency like iron deficiency, in your case and your investigation we have seen. Okay, now second thing you can say that underlying tendency to female pattern hair thinning. Okay, on the top of shedding, your pattern of thinning along with the parting and crown and family history suggests that genetic tendency to female pattern hair thinning. Okay, if like say patient having history of hair thinning, family history. Okay, so emphasize that she is not going to wake up bald overnight. First of all, you have to reassure the patient. Okay, the process is gradual and there are treatments and strategies available. Okay, now we have to go with the first reversible factors to correct, which is the iron deficiency anemia. Patient having iron, we have to give iron supplementation, ferrous sulfate as per the local guidelines, discuss about the side effects and investigation the causes of iron deficiency if not obvious. Like say patient having heavy periods, you rule out already. You have to see that what kind of diet patient is taking on. So patient may be taking low iron rich diet, patient is taking processed food or junk food, whatever, so on. Aim to bring the ferritin up and recheck in 3 to 6 months. Explain that low iron makes shedding worse. Okay, hair improvement may lag by a few months after the ferritin improves. Okay, it is not going to improve in overnight. Okay, general health check. That's if like are not done, so you've done already TSH, B12, folate, and possibly vitamin D. Optimized diet, adequate protein and micronutrients, and stress factors you are going to have. So you have to address patient this what you call it. Stress relieving factors also you can ask about some yoga, some relaxation exercises, relaxation music, whatever, so on. Talk to the family member and engage with activity the family member, this kind of thing you can talk about. Okay, so there are many specific hair targeted treatments are there. Here you can say about topical minoxidil in first line for the female pattern hair loss. Okay, so explain that this is
Okay.
available as a 2% and 5% foam or solution. Okay, applied on affected once or twice for the long-term usage. She have to take for long-term, like say 3 to 6 months. Some people initially increase shedding. Okay, in that you, Mrs. Khan, you might be feeling that your hairs are growing, you're going from your scalp faster, but this is a temporary hair loss. Okay, it will replace by the new growth. Side effect, you can tell about scalp irritation, unwanted facial hair if solution drips. Okay, rarely, but more systemic effects are there. If you have to emphasize the patient that if it is not require, not cured, alopecia, your alopecia, but can slow the progression and stimulates some growth. Okay, and other options you can say that if like say it is not improving, I will be sending you to the specialist. So they might start some medication. Like what, doctor? So you can say that they might start medicine like spironolactone. Okay, under dermatology or endocrine guidance, whatever, so on. But this is not your thing, okay? Low level laser therapy or PRP are emerging nowadays, Mrs. Khan. So in exam, it is enough to say, doctor, that you should know that about minoxidil are mainly prime in the primary care therapy we can give, and we should know that the systemic treatments are usually specialist territory, not our territory. Okay, psychological support and cosmetic measures you have to talk about, and you have to call for the follow-up after 3 to 4 months and talk about if patient say, doctor, I wanted to go to the dermatology, don't hold with you. Okay, I'm going to give you a referral for the specialist. That's it, doctor. So overall, Dr.
Thank you.
Aram, you gone well. Okay, Dr. Kumar is there.
But
Am I
Dr.
right?
Imran, you have too much stress.
What stress,
How could
doctor?
you? For exam,
No worry, doctor. Alhamdulillah, you guys are ready. Ready for the flight, okay? So don't worry, inshallah, you'll pass. There's
inshallah.
no such thing, okay? This case was perfectly carried away. So you see, doctor, let me tell you, if you given the diagnosis in a different way and you refer the case that you suspected something, even though you didn't give in the diagnosis, that diagnosis, for example, patient having some sort of some sort of problem, which is specialist led, okay? Maybe she is having some red flags are there. So if you given the diagnosis something which is related to iron deficiency, you corrected it. One thing. Second thing, you are giving the referral. So means you treated the patient. You didn't harm the patient. You are not. You are a safe doctor. Okay. So you will be. You will get pass. Believe me. Okay. There is no such thing. Okay. That's why I'm telling you, doctor. If, for example, if I'm going to the patient, I will be getting iron deficiency anemia. You will be going with alopecia areata. Dr. Ghulam Nabi will go with other diagnosis. Dr. Sadar will go with other diagnosis. There are 4 to 5 working diagnoses we can fit on this one. Okay, this is based on how I'm running the case, how I'm driving the case. Am I right? Being a doctor, how I'm asking the
Yes.
questions. Okay, there is no such part, doctor. There are now many doctors, doctor, they complain, I have done that one, but diagnosis was that, and he given this one, I given that. Doctor, there is no such harm in that way, okay? As long as you treated the patient, you didn't harm the patient, you didn't did the blunder, absolutely fine. Okay, don't talk about others' experiences. Other experiences might be different. Maybe your experience will be best. Okay, Dr.
Yes, sir.
Kumar.
Thank you, sir.
Yes, sir.
Okay, Dr. Kumar, I'll be taking the last case for February candidate, and after that, I will be moving to our April candidates. Okay.
Sure, sir.
So, Mr. Kumar, your patient is Mrs. Amina. She is a 28 years old female. She's coming with some sort of problem. Take proper history, examination, and manage the patient.
Okay, sir. Done. Start, sir.
Okay, start.
Hello, I'm Dr. Kumar. I'm one of the GPs in this clinic. So, am I talking to Mrs. Amina?
Yes, doctor.
And can you please confirm your age?
Doctor, I'm 28 years old.
So, please tell me how can I help you today?
Doctor, I keep getting this really itchy rash that comes and goes all over my body.
I'm really sorry to hear about that. Please tell me more about this.
Okay, doctor. So, doctor, it's been now 3 weeks. I'm getting this red irregular wheels and bumps on my body, doctor.
Mm-hmm. And any particular part of the body it is appearing?
Doctor, I'm getting this, all over my body.
Mm-hmm. And you mentioned it has been since 3 weeks.
Yes, doctor.
And does it has it got worse since then?
Doctor, it's going and coming, doctor.
Mm-hmm. So any particular time of the day it is coming and going?
Doctor, there's no such thing, doctor. Anytime.
Mm-hmm. So how so when the rash appears, wheel appears, how for how long it lasts?
Doctor, maybe like doctor, after a few hours settled.
Mm-hmm. And have you noticed any trigger that makes this rash?
No clear, doctor. I'm not sure about it, doctor. I had a prawn for a long time before. There is there was no problem. I heard that prawn is
Mm-hmm.
causing the problem.
Sorry?
I took the
Uh,
prawn long ago, but I heard the prawn is causing the problem. But there is no such thing happened with me with the prawns.
Prawns means it is a seafood.
Yes, doctor.
I see. Okay. And anything? Have you taken anything to make it better?
Doctor, I'm just applying this calamine lotion, but no effect.
Mm-hmm. Okay. And okay, I need to ask some other question as well. Do you have any when the wheel appears, is there any as you mentioned there is itching?
Yes, doctor.
And have you ever scratch like bleeding happens?
No, doctor, there's no such thing.
Okay. And okay. And do you have any joint pain?
No, doctor.
Any vision problem?
No, doctor.
Any recent fever and flu?
No, doctor. I'm having back pain,
Any
doctor.
you have back pain? Okay. So please tell me more about this back pain.
Doctor, I was lifting up some, one box from the kitchen.
Mm-hmm.
Suddenly, I got the
Okay.
back pain. So, I'm taking some medication for the back pain.
And how are you doing now?
Hey, it's okay with the medicine, doctor.
Okay. Okay. And okay. So do you have any neck stiffness?
No, doctor.
Okay. So some questions regarding your past medical history. So has this happened for the first time or happened before?
Doctor, this is the first time.
Okay. And do you have any long-term medical condition like high blood pressure,
No, doctor.
high
I
blood
have only
sugar?
back pain, doctor.
Okay. And are you on any sort of medications?
Doctor, I'm taking this tablet, ibuprofen 400 mg whenever I'm getting the pain.
Okay. And any medicine allergy?
No, doctor, I don't have any medicine allergy.
Okay. Do you have any breathing problem?
No, doctor.
Any you have this problem in your childhood?
I used to have a hay fever, doctor.
Okay. And are you allergic to any type of particular type of food like peanuts or anything
No, doctor.
apart from prawns? Okay. And okay,
No,
I
doctor.
need some questions regarding past your personal habits. Do you smoke?
No, doctor.
And what about alcohol?
Doctor, no, doctor.
Okay. So I some questions, very sensitive question I'm going to ask. Some okay. So are you sexually active?
Uh, no, doctor, I am not active.
Okay. Okay. And okay. And how has been your periods recently?
Doctor, my periods are normal.
Okay. Okay. So, I mean, Miss Amina, you mentioned since 3 weeks you have the rashes, and it is appearing as a wheels and rashes, and it goes away after a few hours. And
Yes,
you
doctor.
had tried calamine lotion. So, and you are mentioning that you think it prawn is the reason. So, any idea going across the mind what could be the reason for this?
Doctor, I wanted to add one more thing. Doctor, I am taking this herbal immune booster capsule actually. I started last month. I don't know what's inside.
Hmm.
I don't know whether you will count in that one or no, maybe.
Sure, sure. We shall also discuss about this. And what do you expect from me today?
Doctor, just want some tablet to control this itching, doctor. It's really badly hurting me.
Sure, sure. And anything worrying you?
Oh, well, doctor, I'm worried maybe if suddenly it will develop some sort of allergic reaction, I will stop my breathing.
Okay. Okay, your concern is valid. Okay, so in order to have better understanding of your condition, I need to check your observations, which include temperature, blood pressure, respiratory rate, your height, weight, and I also need to general physical examination, and I also want to check the your wheals and rashes on the body, and I shall make sure chaperone is there. And before examination, I shall sanitize my hands.
Okay, doctor, I'm sharing a picture in the group.
Okay, so based on thank you for letting me examine me. Kindly have a seat. I am again sanitizing my hands. So based on the information which you provided me, I think you have said right that you have hay fever.
Hay fever, doctor?
Yeah, hay fever. So, so do you have any idea about this?
No, doctor.
So it is a type of allergic reaction when when the body responds differently to the some trigger, like some sort of food, medicine, drug, anything like it causes this reaction.
So, do you think, doctor, I have some drug allergy?
Yeah, so it might be possible that you have drug allergy, but I'm not sure at the moment. So as you mentioned that recently you have started medicine since 1 month, a new medicine, and your rashes, hay fever has been increasing since 3 weeks. So I think there
Yeah.
might be some relation with this. So why do you take this medicine? Have you anyone prescribed you this medicine?
Doctor, I wanted to glow my skin.
Okay, so so have you seen any improvement?
No, doctor.
So who prescribed this medication?
I was looking at mm, um, one advertisement.
Okay, so is it possible for you to stop this medication?
Uh, Doctor, why?
I think this is a medicine which might be the reason that your hay fever is getting worsening.
Hmm.
Yeah. So is
Okay,
it possible for you to stop this medicine? And later we shall discuss about the other treatment so that about your skin glow later. Is that okay?
okay, doctor, but why isn't any something wrong?
Yeah, we don't know the contents of this medicine.
Hmm.
So that is the reason this skin reaction is happening. So I'm going to give you whenever you get this type of reaction, you take the medication which is called fexofenadine 180 milligram state OD.
Hmm. Hmm.
Okay, and there is no need to apply calamine lotion. And if you feel that
Hmm.
you are having breathing difficulty or if any bleeding coming out from any part of the body, so please get back to the nearest hospital or to the, you can call me again. Is that okay?
Hmm. Hmm.
Okay, and also note down the diary, which in which you can say that if you feel any type of drug reaction or if you experience these reactions after any exposure to anything or eating anything, you can immediately note it down on diary so that in our next visit we can correlate the data. Is that okay?
Okay, okay, doctor.
Okay. Do you have any questions so far?
No, doctor.
Okay. And apart from this, I'm also giving you a leaflet about this condition. If you have any questions on this condition, please get back to me.
Okay, doctor.
Okay. Thank you for consultation.
Okay, doctor. Dr. Kumar. Still, you have 1 minute left. Do
Okay,
you
sir,
think
मैं कुछ
anything
बोल
you're
रहा
missing?
Yes, sir. Okay, so apart from fix of Indian, I'm also going to. I forgot one thing. Are you any plan to for pregnancy?
No, doctor.
Okay, I'm also going to do some blood test investigations, which include complete blood count, serum IgE level. Also, I shall do some skin patch test. Is that okay?
Okay, doctor.
Okay, in the next visit, we shall gather this result and we shall discuss again.
Okay, doctor.
Yeah. Do you have any questions so far?
No, doctor.
सर कुछ बोलो?
I will tell you.
Okay, okay. So from my side, it's done.
Okay, doctor.
Yes, sir.
Very well done, Dr. Kumar.
Hmm.
Just for the differentials, I wanted to explain. Otherwise, you didn't miss anything. Doctor, whenever we are explaining to the patient, no, we are 100% correct. But there is one thing we call it
Patient understanding.
no, patient-centered.
Yeah.
Okay?
I felt I'm not patient centered.
No. You are a patient-centered doctor. You are don't. You are. It's not like this, doctor. It's not like
I
this.
say okay,
Okay.
okay.
There is a few things that the doctor. We can say our sentence many ways. Okay. First of all, give some gap, little bit gap, not to go in a hurry that if patient wanted to ask you anything, but you are not giving a gap. Otherwise, well done. So you rightly got the trigger. But one thing, doctor, red flag was missing. Okay.
Sir,
Okay.
weight
Red
loss.
flag. Wait, no, red flag was there. Patient was getting angioedema.
True.
Okay. You ask about breathing difficulties, fine for me. But still, I'm thinking you can do more much better than that one. Okay.
Swelling of the lips, or
Yeah.
and dressing of the heart, or
Yeah. No,
and
so
also
doctor,
I forgot. I also forgot, sir. Glowing skin, like eat healthy diet, good hydration, like
hmm,
this.
yeah, wonderful, doctor. There is no such thing. It is not possible, doctor. Whatever you read on Kumar and Clark's and that current medicine CMDT 2026 more that publication, it is not possible that you're going to read all 15 pages, no? So
True, sir.
from there, from our examiner, from there, from whole that 2 pages or 3 pages, we are going to pick two or three lines. Okay, like
True,
say you
sir.
can say that Mrs. Khan, I'm suspecting that you have that condition, what we call it urticaria hives, which is like say
Oh.
raised itchy wheals and that comes and go. In many people, there is not one single allergic cause. Okay, so in that your reason, I'm suspecting that few causes are there. So first of all, you're taking the medication for ibuprofen. So just wanted to clear there itself. You have to clear that. Is that this problem you are getting after taking ibuprofen tablet? No.
True, sir.
Okay. Yes. Then the second thing, you are taking these supplements. I'm suspecting that one is we don't know about this thing, and we don't know about authenticity of that you are taking this herbal immune booster. So it is not. I don't think so. It is authentic. Okay, it might be the causative agent, as you say that you it started just 1 month ago. You started this 1 month ago. So right now there is no signs of anaphylaxis in you, that you are not suffering from any breathing and circulation problem. Most of the cases are not life-threatening. Okay, you have to assure, but you have to be honest in a way that if it can be recurrent and sometimes we never find a precise cause, okay, but we can still control the symptom effectively if in most of the people. Okay, your case, I'm going to stop the NSAID like ibuprofen, herbal supplement, discuss viral infection, stress can precipitate like say urticaria. So you have to ask about recent illness. Okay, now emphasize on the symptom diary, what she eat, medication, supplementation, supplements taken, and after exposure to heat, cold, pressure, exercise, whatever, so on,
Yes.
and
True.
when the rashes appears. Okay. Now, pharmacological, you can say you can give non-sedating H1 antihistamine, you can give cetirizine or fexofenadine, loratadine. But my suggestion, because here examiner wanted to see you that you how cost effective you are. Fexofenadine, doctor, is expensive drug.
Very expensive, very expensive. But it is
Okay, so we
over-the-counter drug.
yeah, but doctor, we have to be now here. They are going to see that how much you are a cost-effective doctor. Okay, you are like say a cost-saving doctor. So you can say loratadine, one of the cheapest drug. Then
I
cetirizine.
see. Chlorpheniramine.
Doctor is very old drug. Don't give.
Okay, because
Okay.
these are professor level people. They always like penicillin, benzyl penicillin type of drugs.
Yes, when there is an emergency, you have to explain the patient. If you are getting swelling of the tongue, here red flag is mandatory. So safety netting is mandatory. So swelling of the tongue, throat, and difficulty in breathing, tightness in the chest or wheezing, trouble in speaking, and feeling faint, collapse, or fast heartbeat, and rapidly spreading rashes together with the breathing and circulation symptoms. And you have to call the emergency if, like, so you are getting this problem. Investigation. There is no extensive investigations are needed initially. Patient come to you, initially it is not needed, okay?
Yeah,
But
true,
you
sir,
might
true.
consider in a primary care symptom, if
Mm-hmm.
patient having chronic or severe problem, then you can go for full blood count, ESR, CRP, thyroid function test to note about thyroid antibodies like say autoimmune link,
Yeah, true.
LFT for fatty liver issues and urea electrolyte because of hyperuricemia, kind of stuff you can go for. But do not promise broad allergy testing services, okay?
Got it, sir,
This
got
is a
it.
pitfall. This is a pitfall, doctor. When you're saying this one
Yeah.
that I'm going to do your skin prick or IG panels for non-specific urticaria, so here examiner will give you some sort of not good impression, huh?
Grimace, he may.
Yes, doctor.
Yeah.
Dr. Nadia is there. Dr. Nadia, I'm giving you one case.
Thank you, sir. Thank you very much, sir.
Thank you very much,
Dr.
doctor.
Imran, is this
Yes, doc.
we can say about this case hay fever is it's very nice doctor done, but we can say urticaria also.
Doctor, this is a chronic urticaria or urticaria due to drug. It's not a
Yeah,
hay
this is
fever, doctor.
article. Yeah, this is article.
Urticaria, so we can
Yeah,
say
this
the
is
hay
Dr.
fever. There is no fever.
No, there is no fever, doctor. Let me tell you, patient having
Hmm.
history of hay fever, so he explained. But as long as he given the right treatment, he is not going to fail. Okay, diagnosis doesn't matter over here. Okay,
Okay.
that's what is there because he
Hay,
didn't
hay,
given
hay
any
fever,
wrong.
which I remember, there is a pollen or rose or flowers. There is in the
And you know
seasonal
why
also.
he said hay fever? Because he missed the trigger. Okay, he suppose he
Hmm.
should ask that whether you're getting hay fever now or not. He used to get in the
Hmm.
childhood.
But just I have one question, Dr. Imran. Is
Yes,
this
doctor.
case hay fever or urticaria? If I
Urticaria.
say urticaria, then
Urticaria, but you have to see that triggering causes are there. Patient taking the brufen and she's getting this rashes after taking the brufen. Okay,
so drug
she's
induced.
getting yeah drug induced. She's taking
Ah,
this rashes because of immune booster. Okay, so
okay.
now here patient says that he's taking now. Here we have to ask whether you are able to you're getting this problem after taking this medication or when you're getting this problem. So here
Thank you,
that
Dr.
SP
Imran.
is supposed to tell that yes doctor, I'm thinking that I'm getting after this problem after taking ibuprofen or
Hmm.
maybe after this immune booster, but I'm not sure
Hmm.
because
Okay.
she wanted to get rid of the pain, so she's
Thank you.
not caring about that what is going to cause it.
Thank you,
Okay,
Dr. Imran. I got your point. Okay. Thank you very much.
welcome. Dr. Nadia.
Yes, doctor.
Doctor, your patient is a 46 years old Mr. Malik. Sorry, Mrs. Malik actually. She come to discuss her problem with you. Take proper history, examination, and management plan. Okay.
Okay, doctor.
Okay, start.
Hello, I'm Dr. Nadia. Today I'm your GP. May I confirm your name and age, please?
Doctor, my right wrist and hand having really painful and tingling sensation, especially at the night.
Okay. Can you tell me more about it?
Doctor, it's been 6 months now. Doctor, it's really worsening now, day by day. Initially, I was getting this tingling sensation in my hand and the right wrist, and then it goes to the hand. Now, my thumb, my index finger, my left half of ring finger, literally, I am feeling trouble, doctor. And I have to, I'm just feeling worry all the time. I'm getting this pins and needle and burning sensation.
I'm really sorry to hear that. I would like to ask you for further questions.
Sure, doctor.
If that's okay. All right.
Sure, doctor.
Can you tell me when does this precipitate these tingling sensation and heaviness of your hand and all this which you are actually having right now?
Doctor, let me tell you, doctor, I'm having this problem where at the night specifically. Okay, I
Okay.
have to shake my hand to get
Mm-hmm.
relief. And worse, when I'm getting this, when I'm driving, holding
Mm-hmm.
phones, typing for long periods.
Mm-hmm. Okay, I can understand that. Do you have any other associations with it? Like, what about your sleep?
Doctor,
How
my
is your
sleep
sleep?
is disturbed because of this pain.
Mm-hmm. Mm-hmm. And with the whether it's cold or hot, does it bother you?
No, doctor, there's nothing such thing, doctor.
Okay. All right. Do you have any other chronic illnesses like
No, doctor.
nothing like that? High sugar level, high blood pressure,
No, doctor.
nothing.
No, doctor. I am
No.
having a thyroid problem, doctor.
You have a thyroid for problem. Since when are
Yeah.
you having
Doctor,
hypothyroid?
it's been 10 years, doctor.
And what are you taking for it?
Doctor, I'm taking this tablet, levothyroxine, 25 microgram.
So when did you last check your thyroid function?
Doctor, it's been now 1 year. I don't go to the doctors, doctor.
Okay. All right. Anything else you want to add related to this? Did you gain any weight?
Yes, doctor, I'm gaining weight day by day.
Mm-hmm.
I recently
Okay.
checked my BMI, doctor, it's 31.
Okay. All right. And you're even having rice, coarse skin with it, all these symptoms of hypothyroidism.
No, doctor, my skin is fine, but I'm having hair fall.
Oh, hair thinning. You're taking
Yes,
your
doctor.
medication regularly?
Yes, doctor.
You're taking, okay. So okay. So do you have any allergies to any other medications?
No, doctor.
Nothing like that. And in your family, does anyone have any chronic, long-standing illnesses? Same like you're having like thyroid issues and high
Doctor, my
blood
mother was
pressure.
diabetic.
Okay. All right. And may I know that you said that while typing also you're having this problem. May I know that what
Hmm.
type of work you do?
Doctor, I'm a stenographer.
Okay. All right. And do you smoke?
Yes, doctor.
How many cigarettes a day you're taking?
Doctor, I'm taking 15 daily.
15. For how many years you're taking?
Doctor, just recently started 2 years ago.
Hmm. Have you ever thought that it's hazardous to health and you need to stop it? It can affect your
Doctor,
health.
I tried, but my stress job is like this, so I have to
Hmm.
take
Hmm. Hmm.
this one.
Okay, whenever you're ready, you can tell me so that we can add you in the cessation smoking clinic, if that's
Sure,
fine.
doctor. Sure,
Right?
doctor.
Do you drink alcohol?
No, doctor.
Okay, so that's good to hear. So I need to ask you that how is your lifestyle actually most of the time? Like, are you exercising?
Doctor, I'm not getting time, so I have to sit in front of the computer for 12 hours.
And what is your diet?
Doctor, I'm eating everything from outside, not
Mm-hmm.
cooking at home.
Okay. Okay. What do you think? What's going on with you?
Doctor, Maybe I have some sort of trapped nerve in my hand.
Mm-hmm. Okay. And you're living alone or you're living with someone? Is there any support system at home?
Doctor, I'm married.
Okay. Mm. You have kids?
Yes, doctor, I do have.
All right. And your husband is supportive?
Yes, doctor.
Okay, that's good to hear. So, and what is actually worrying you?
Doctor, I don't want to become disabled, doctor.
Mm, I can understand that. And what do you hope from today's consultation?
Doctor, can you give me some medicine so I will take and I will be better?
Sure, we'll come to that as well. And how it's affecting your life?
Doctor, as I told you that I'm a stenographer, so my job is to always on the system. So it's not possible for me to
Mm-hmm.
take off from the work.
Mm-hmm. Can I, all right, before reaching my diagnosis and explaining it to you, can I have a look at you? Can I examine you?
Yes, doctor. Go ahead, doctor.
All right, I'll sanitize my hands and I will check your pulse. I'll check your hands as well, your wrist actually. And can you open and close your hands? And can you just stretch them out so I can see any tremors
Mm-hmm.
with it? I will just, you need to, up the thumb and the fingers. Please, can you just join your thumb and fingers to each finger, your thumb to each finger, if that's fine with you? I'll do a
Okay,
test.
doctor.
Okay, I will do a test. I'll tap on the wrist of your hand. If there's any
Mm-hmm.
pain, let me know, any sensations. And we'll
Mm-hmm.
do a prayer sign. We'll do that. We call it a fennel stills. We do that. Okay. If there's any pain, I'll just check that in a minute. So if there's any pain, let me know. Right? It will be upside down.
Okay, doctor.
Okay. And I will check your eyes for any anemia and your throat and your oral cavity and neck for any lumps and bumps in your thyroid gland. And I'll check. I'll just check the 4 areas of your heart and bases of your lung. And of course, I will
Mm-hmm.
check the fetal edema as well. Check
Okay,
this
doctor.
and pulsations. And of course, reflexes, ankle reflex. Check. Okay.
Okay, full leg range of movement with mild stiffness, no swelling sign, shoulder examination are remarkable. For the hands, she's having slight fluttering of the thinner eminence on the right compared to the left. And palpation, normal. Neurological examination shows that reduced light touch and pinprick over palmar aspect of the thumb, index, middle, and radial half of the right ring finger.
Mm-hmm.
And that's it, doctor.
Okay. According to your history and examination, as you said that it's been quite some while now, it's been 6 months that you're having these tingling sensations in your right hand, and at night you're unable to sleep as well because of this, and the hand feels heavy, and you have to, shrug your hands to relieve it. And it's now it's affecting even your work and lifestyle as well. So the thing is that it seems that as if after your examination you're having a condition called carpal tunnel syndrome. You know what is it?
Okay, what is it, doctor?
As you thought that maybe your nerve is trapped in exactly because you're having a condition called hypothyroidism. Your neck gland is not making much of that energy chemical
Hmm.
hormone. All right.
Mm-hmm.
So when you have not even checked for a while and you lost the follow-up as well. So I would
Mm-hmm.
like that it should be checked. Maybe that is the main cause that it is causing this carpal tunnel syndrome. Okay. The nerve is getting trapped
Okay.
because of the edema and the wrist is getting tight. Okay, so
Mm-hmm.
what we are going to
Mm.
do, we're going to do some initial measures, lifestyle
Okay.
changes, right? You need to first we'll check your TSH level, okay, and we're going to optimize your levothyroxine, okay,
Okay,
right?
doctor.
And with lifestyle, and of course, your body mass index is a bit high, so you need to cut down on those fatty diets and home cooked meals you have to take, so that and some exercises you have to do. Even a 30-minute walk, even stroll around in your office is enough, okay, every day. Or
Okay, doctor.
okay, and a splint. We'll give you a splint at night. You need to wear that. Okay,
Okay,
initially we'll
time
do that.
up. Dr. Nadia, good attempt. First of all, working differentials I'm going to talk about, but just I will give you in a nutshell what we should do in this patient. So are you giving me a doctor, are you giving any painkiller to this patient?
Yes, doctor. I was going to give her NSAID, ibuprofen with pantoprazole. That I was
Doctor, you
going to
can,
do, and
doctor, you
splint.
cannot give any painkiller for the carpal tunnel syndrome.
Yeah, but if she's having pain,
No,
we
you
can.
cannot give. Still, you cannot give. You have to give steroid injection.
Yeah, but that's the last resort, doctor. First, we have to splint it. And if it
You
doesn't,
have to
then
you have to give splint, but no painkiller. Okay, if you're saying the painkiller, that is a pitfall. Okay,
okay.
so do not treat the nerve compression alone. Okay,
That's why I'm
so
giving her splint, doctor. I didn't even talk about a painkiller till you talk about it.
no,
So
that's what I wanted to know about that. What's your idea?
a splint
Okay,
and is the last resort, and then surgical
yes.
intervention is the
For
next.
from our side, we are going to give this splint one thing because we call it neutral position wrist splint. Okay, so we have to tell what I'm going to do it to be worn at night, possibly during the provocation activities. Okay, and we have to give a letter to his company, her company,
Yeah.
to give her some sort of resting, some different job. Okay, and activity based, you have to take frequent break from the keyboard and mouse work, adjust desk or keyboard height, avoid prolonged wrist flexion and extension, so many things. You did very well. But again, you have to shorten your pause because you're taking a little bit more pause, so it is wasting your 1 to 2 seconds in between. Okay, so it will be time saving for you to get better.
Actually, doctor, I was going to recommend her to use a Dragon mic. No need to actually even type. She can
Mhm.
use the Dragon mic, and that can type automatically.
Mhm.
Like you can use that actually. And that's it.
Okay, well done, doctors. From February, I'll be taking break now. I'll be going to our April group. Okay, so Dr. Sanobar is here. Okay, Dr. Sanobar joined now. Okay, Dr. Sanobar, are you ready?
Okay, doctor. Give me 1 minute.
Okay, doctor. I'll be taking your case now. Uh, okay, so we'll be taking three, four candidates from our April 2.
So which topics are we gonna cover in this session? The same you mentioned in the group, those?
Yes, doctor. We will be covering DVT, peripheral artery disease, and varicose vein. Okay, peripheral artery disease came in day one exam in Karachi this time. Okay, and DVT, I think came. I'm not sure about it. Okay, Dr. Snober.
Yes, doctor.
Give me 1 second, Dr. Doctor, always remember that we don't remember only, don't, remember that first line. Sometime patient might ask you second line drug or second line treatment also. Okay, brain
Okay.
patient might be using, so be careful and be more advanced than patient, because patients are more advanced than us.
They have more knowledge.
Yeah. Okay, Dr. Sunobal, your patient is a 54 years old Mr. Suhail. Come to discuss his problem with you, take proper history, and manage the patient. Okay.
54-year-old, right, doctor?
Yes, doctor, 54.
And 54, Mr. Suhail, right?
Yeah.
And what is this? Examination, management, and history, right?
History, yes, doctor.
Hmm.
Okay, start.
1 minute, I will put my time.
Yes, Dr. Sunobal, start.
1 minute, I will put my timer as well. Okay.
Okay, doctor.
Hello. Good evening, Mr. Suhail. I'm Dr. Snober. How can I help you?
Doctor, my left leg has become swollen and painful over last few days. I'm worried that it might be some sort of something wrong in my leg.
I can understand, Mr. Suhail. Can you tell me more?
Doctor, it's been now 4 days. I'm facing this problem and swelling in my left calf, and it's gradually worsening, doctor.
4 days and swelling in the left calf. Okay. Is this the first time you are getting this pain, Mr. Suhail?
Yes, doctor, I'm getting this first time.
What about your right calf?
Right leg calf is fine, doctor.
Right calf is fine. Okay. Can you tell me that if I will give score of the pain from 1 to 10, how will you score your pain? 1 being the lowest, 10 being the highest?
Doctor, when I'm walking, it's like a 6, and when I rest, it's 3.
I see. Okay. When you are walking, it's more. When you are resting, it's fine. Right? Am I right?
Sure, doctor. Yes, doctor.
Okay. Okay. Can you tell me? It's only in the left leg, not in the right, right?
Yes, doctor. Yes, doctor.
Okay. Okay. Can you tell me the character of the pain, like how you feel this pain is?
Doctor, it's like, say, dull or some tightness, and occasionally when I'm getting this pain as a sharp while walking.
Along with the swelling, is this swelling along with this pain started? Like it started all of the sudden?
It started gradually, doctor.
Now it's increasing.
Yes, doctor.
Do you have any fever?
No, doctor, I feel feverish.
Oh, I see. Any shortness of breath?
Uh, Slightly more breathlessness on the stairs, but not severe, doctor.
Oh, I see. And what about chest pain? Any chest pain?
No, doctor.
No chest pain. Do you feel any numbness or weakness in this leg? Numbness in this leg, left leg?
No, doctor.
Any weakness?
No, doctor.
In the past, do you have any clots in the legs? Any history of clots in the legs?
No, doctor.
In your family, anybody is having clots of legs?
Doctor, my father had a clot in his leg when he was 60. After his operation, he had some sort of operation of the leg.
And how he is doing now?
Doctor, he passed away, doctor. He had a heart attack when he was 70.
Oh, very sorry to hear about your loss. Can you tell me, do you take any medications in the past, like long-term medications for high blood pressure?
Doctor, I'm taking high blood pressure medicine. I'm Lodipine 5 mg.
And since how long?
Doctor, it's been now 20 years.
20 years. Are you regularly taking these medications?
Yes, doctor.
Regularly follow up with your doctor?
Yes, doctor.
Any idea about your last blood pressure?
Doctor, my last blood pressure was today morning. I had check at my home. It's 130 by 70.
Okay. What about high sugar? Do you have any high sugar?
No, doctor.
High fat in the body?
No, doctor.
What do you do for a living, Mr. Sohail?
Doctor, I'm a businessman.
You're a businessman. And how's the things at work?
Stressful, doctor. I started new business.
I can understand. And whom do you live with?
Doctor, I'm living with my wife.
Your wife. Okay. How's the things at home?
Everything all right, but I have some issue with my wife.
No, it's okay. You can tell me anything. Anything you tell me, it will be between you and me. I'll make sure that confidentiality is maintained in this room. It will not go outside this room, Mr. Sohail. So please feel free to talk to me.
Doctor, she said that I am not more like before. I don't feel, I
You
can't
have
make her
problem in
happy.
your you have problem in your personal relationships.
Yeah,
When it started?
it's been a couple of months now.
We'll talk about it. Okay, don't worry. Okay, can you tell me that do you smoke?
Yes, doctor.
How many cigarettes per day?
Doctor, I'm taking 20 cigarettes daily.
Since how long?
It's been 20 years now.
What about quitting the smoking?
Doctor, I started new business. So I'm thinking to increase the smoking. You're talking about reduce the smoking, doctor?
We'll talk about it because it's better if we talk in the next session regarding the smoking cessation. Let us have a talk. We'll see how the things will go. What about that?
Sounds good, doctor, but let's see how things going on. But now treat me, doctor. My problem is going on.
I cannot say. Any idea about your weight according to your height?
Doctor, I increased my weight. My BMI is now 37.
I can see. Okay. Do you drive?
Yes, doctor, I do drive.
What type of diet you prefer?
I'm eating everything. Most of the time, I'm a business trip overseas, so I'm taking everything because not possible for home food everywhere.
I can understand. What do you think about this leg pain?
Well, doctor, I was Googling. It sounds like it's DVT.
Okay. And what worries you more today?
Just worried about it could be clot, so I have to travel back again. Uh, so if like say in this scenario, if this clot is dislodging and going to my lung, it might kill me.
I can understand your concern. In what way you want me to help you today?
Doctor, I just want to know if there is anything medicine, they call it blood thinner, so you're going to give me.
I will try my best to help you. Let me summarize. You have this calf pain since 4 days along with the swelling, and you are hypertensive taking the medication amlodipine, 5 milligram, right? So you came today because you think that it's a DVT and maybe this clot will go to your lungs. So you want me to have give you something so that because you have to travel, so you are worried about that. Is there anything you want me to add, Mr. Sohail?
No, that's it, doctor.
Okay, I would like to take your do the examination for you. Is that okay?
Okay, doctor. Okay,
Keeping
doctor.
full privacy, okay. Keeping the chaperone with me, I would sanitize my hands. Okay, can you please can I check your blood pressure, pulse, temperature, oxygen saturation, and I would like to check the lymph nodes of your neck. I would like to check your eye, back of the eye, your nose, your mouth. Can you please do for me to look for any sinuses? Okay, I would like to check the lower limb edema as well. I would like to check the pulses of your both. Can you please come to the couch? I would like to have a first look at your both legs, and I would like to check the pulses in both right as well as the left legs, dorsalis pedis pulse and tibialis anterior pulse. Okay. Do you have any picture? Like, can I see it? Any
No, doctor,
picture?
examination finding shows left temperature 37.6, left
And I would like
calf
to measure the calf,
visible.
yes.
Okay, left calf visibly swollen compared with right. Measure 10 centimeter below tibial tuberosity. Left calf circumference is 3 to 3.5 centimeter larger than the right. Skin
Mhm.
warm and slightly erythematous over the calf. Palpation, tenderness along the course of deep veins in the calf, most marked in the mid calf. Okay, hepatic edema present in left lower leg only. No
Mhm.
obvious. Okay. Rest of the examinations normal.
Mhm. Okay, Mr. Sohail, can I run some tests also for you? Is that okay for you?
What you
I
want to
would
do,
like to
doctor?
do the CBC. I would like to do your HbA1c, fasting blood sugar, your lipid profile, LFT, CBC, this kidney function test, and I would like to send you immediately to the hospital for the color scan of your legs. What about that?
Sounds good, doctor.
Okay, so I would like to send you. I will call the my nurse so that
Time
they
up.
will. Okay, can I continue treatment?
Okay, continue, doctor. Let's see what
Okay.
you do, what you're doing.
I will refer this patient because this is DVT, so same day referral. This clot, this is a condition called DVT. This we can say that there is a clot in your legs, which it's very dangerous condition. Like it's a very serious condition. This clot can travel up to your lungs, and you will be having problem in your breath as well. So it's better
Okay.
right now to send you to the hospital for the to the emergency. They will do the
Mm,
scan of your legs there, and will start you on the treatment after
mm,
that. And for here, I would like to talk about BMI. Okay, what about reducing your weight? Take the healthy diet. Blood
mm.
pressure was okay, and he was worried about that his personal relationship was not okay. So after you finish after you will come back from the hospital, I would like to have a meeting with you. We will discuss about your this sexual relation, private relationship. So, and leaflet about smoking cessation. We can talk about smoking cessation as well. Keep your legs elevated after the discharge from the hospital. If you get any discharge of shortness of breath, chest pain, please do come back to me or to the nearest emergency. I would like to see
Oh,
you after the discharge from the hospital.
okay, doctor.
1.5 मिनट मैंने और लिया डॉक्टर.
It's okay, doctor. Sonobar, did you ask travel history?
No, I didn't ask. Travel and surgery. Yes, I will.
No, for April candidates, I am not that reluctant, doctor. I have to
Okay.
be more stricter on that one. First of all, let's have a healthy discussion on this one, okay? So
Mm-hmm,
we have to suspect in DVT when patient having classical picture of
mm-hmm,
unilateral leg pain, patient come with swelling, warm, erythema, are dilated superficial veins, often with risk factors. Okay,
mm-hmm,
patient might have recent surgery or immobility, especially in the females. We have to expect in elderly, we have to expect if patient having active cancer, pregnancy or postpartum. Okay, and the female always ask about the LMP, huh? And
mm-hmm.
estrogen therapy. If patient is on any therapy about estrogen, you have to ask about previous VTE, like say non-thrombophilia patient and significant medical illness like say trauma, long-haul flight travel. This patient
Okay.
had a problem. He traveled.
Because he's traveling.
He he traveled long haul flight from UK to UAE for 8 hours flight. So that was a triggering factor in this
Okay.
scenario.
Mm-hmm,
So always consider differential for doctor cellulitis,
mm-hmm,
ruptured Baker cyst,
mm-hmm.
muscle tear, hematoma, chronic venous disease, lymphedema, and neuropathic pain. Okay.
Okay.
Now, you have to tell that I will be doing a clinical prediction score, okay, well score
Well
of the
scored.
DVT,
So that
okay,
we have to tell, huh?
okay.
Okay.
But now, well scored DVT likely or unlikely, but
Unlikely.
D-dimer positive guides your next step,
Yes.
okay. So, have you done about that one investigations?
No, D dimer. I think doctor ultrasound. No, we don't have to do first Doppler. If Doppler not available, then
Doctor
we will go for
ultrasound.
Doppler D dimer, right?
Okay, D-dimer, okay. But now
Mm-hmm.
in GP setting, for example, you can say
Mm-hmm.
in a way, both ways you are right. Okay, now
Mm-hmm.
assess the bleeding risk, like say recent major bleed, platelet, liver disease, patient is alcoholic, you might suspect alcoholic liver, or dual antiplatelets, or history of fall,
Mm-hmm.
like in elderly patient. Now, investigation
Okay.
pathway, doctor, there are we have to follow. If like say patient having likely the DVT, okay, so
Okay.
we have to arrange urgent compression duplex ultrasound as you told of the affected leg ideally the same day. You have to say
Mm-hmm.
that you have to tell the duration same day.
Same
Okay,
day.
if imaging will be delayed more than a few hours
Then we
and
can
there
do the
are there
D-dimer.
are no major contraindication, start interim anticoagulation, usually DOX.
Yeah. Okay.
Loading dose or therapeutic low molecular heparin as per local guidelines again. But if like
Okay.
say patient gone for ultrasound, positive, confirmed DVT,
Mm.
continue full anticoagulation.
Okay.
Okay,
Mm-hmm.
you can verbalize this thing. Okay,
Okay.
then negative but high suspicion. What you will do,
Okay.
doctor? You're going to repeat this scan again 5 to 7 days
7 days.
as per the
Okay.
local protocol and continue or withhold anticoagulation according to the risk factors.
Mm-hmm. We have
But
to
for
treat it.
example, doctor,
Mm.
yes, if for example patient is having DVT unlikely, so we are going to arrange the D dimer. If if this is a safe and available promptly, huh? Here
Mm-hmm.
again that availability also matters, no?
Yeah.
Some
Mm.
clinics they might have a D dimer, some clinics don't have a D dimer. Okay,
Yes.
but you can say according to your practice and your what you call it style. If like say D dimer is negative, examiner say that examiner DVT, sorry, D dimer negative. So we already excluded this is not a DVT. Huh?
Okay. Mm.
But patient doctor SP that
But if
examiner
they are
says D
telling if
dimer
we
is
are, yeah, but the doctor, they have different scenario that if it is suspicious, then we can do, right?
yes, doctor. But
Okay.
then again I'll tell you, if
Mm.
examiner say D dimer positive or patient is coming with one report, doctor, I was having the leg pain. I'm giving you one scenario. This is different scenario than this, huh?
Okay.
Doctor, I was having this leg pain. I went for a travel. Doctor told me to do this test. I did this D-dimer, but doctor is not present at the desk now at the moment. Can you
Mm-hmm.
tell me what is this? If he's showing D-dimer is positive, again you are going to take the
Do
whole
yeah.
history. Okay, but here examination will not be required.
Okay. And then we
Okay,
will tell him to do the
yes,
ultra, the
but
Doppler
patient
ultrasound.
says yes. But now
Mm.
here one trick, one suspicious is there. Then you are going to tell that doctor. Sorry, you are going to say that patient having fever. Okay, you are going to examine the patient, doctor.
Mm. Yeah,
Okay,
that's what I asked to fill fever because then it will be some infection like
yes,
cellulitis and all.
exactly.
Mhm.
Okay, if like say patient having D-dimer positive, manage as a likely DVT, urgent ultrasound, interim coagulation. Like say examiner says, recent appointment is available 2 weeks,
Okay.
or that nearby hospital is a distance of 10 days, maybe or 5 days, or whatever,
Then we
2 days,
have to
whatever.
start the works.
Yes, here this
Yes.
agenda might come. Okay, this is
Okay.
the third scenario. Number four scenario, doctor, it might arise. Patient come with a report of ultrasound.
Mm-hmm.
Okay.
Mm-hmm.
Again, as per the ultrasound report, now examiner want to see how safe the doctor you are. Huh?
Mm-hmm.
So you have to act accordingly. Now for the red flags for our immediate emergency referral rather than routine pathway. For
Mm-hmm.
example, if you're suspecting pulmonary embolism, patient having
Embolism is
dyspnea,
shortness of
okay,
breath. Yes.
pleuritic chest pain,
Mm.
hemoptysis, syncope, tachycardia, or hypoxia. Why general physical examination is important, doctor, here? Know about patient tachycardia, am I right?
Mm.
Then, what you call it, phlegmasia. Like say, patient having massive swelling, pain, cyanotic limb,
Mm.
or threatened viability. You are thinking that he or she might lose the limb if it is not been sent over there within the time frame.
Okay. Mm.
Okay, and
Mm.
hemodynamically instability or significant comorbidities need admission. For example, cancer patient is there.
Mm.
Maybe some you know what you call it pregnant lady is there.
Mm.
Okay, so you have to urgently refer this patient. Okay, diagnostic uncertainty with systemic illness, like say patient having sepsis or necrotizing fasciitis, whatever so on. Now, doctor, anticoagulation, many doctors, many protocols are there, but again, we have to follow as per that protocol, whatever local guidelines says, as per South Asian guidelines. Okay, so and that one always you have to get your up to date information about local guidelines. Okay, so. That one I'm not going to talk it. First line option for the non-pregnant adults, no cancer and no severe renal impairment. Most guidelines doctors, they are saying that typically favor for the docs as a first line
Okay.
for most uncomplicated DVT. So, doctor, here you can start from apexaban, rivaroxaban, or dabigatran, or edoxaban, whatever, so on. Choice is guided by the renal function, age, weight, drug interaction, and patient preferences. Okay. For example, if patient having some sort of, it's not suitable, doc is not suitable. So you can go for, you can say that I
No
might
meat.
start, okay, I'll be
Yeah,
discussing
no
this,
meat.
your problem with my specialist. After that, I will be going to start, I'm going to start it, okay? And even though if like say you are not sure about the docs, again, you can say this word in your OSCE that I will be taking the specialist,
Advice or
advice. After
opinion.
that, I'm going to start opinion. After that, I'm going to start this one, or I'm going to check the local guidelines, or I'm going to check, sorry, that BNF, whatever, so on. Okay. Duration of anticoagulation. This is again for the GP review. Okay. To know about risk benefit conversation is the key. Okay. In the journal, provoked DVT, like say major surgery, trauma, short-term immobility, estrogen therapy stopped.
So
Okay,
that is provoked.
provoked.
Yeah. So we
Yes,
will give 3 months. If unprovoked, 6 months.
yes. And when we will stop, then stop assuming risk factor as a result and no ongoing his recurrence risk. Okay, unprovoked will be unclear. Though no clear transient factors are there. So here you're going to start 3 months and
Okay.
reassess the patient.
Okay.
Okay, and many patients will consider for extending or indefinite anticoagulation if the bleeding risk is not high.
Okay.
Okay, and particularly with proximal DVT or pulmonary embolism history. Okay, patient if like
Okay.
say now one scenario doctor can arise recurrent DVT or strong thrombophilia. Okay, this one we have to go for often lifelong anticoagulation. Here agenda will be there that how much you have the knowledge on the anticoagulation for long run. Okay, and we have to adjust according to the bleeding risk. Okay, and monitoring a safety. Again, we have to do the baseline, full blood count, urea electrolyte, LFT, coagulation screen, weight, pregnancy test. If like say patient is female, where relevant. Okay. Don't forget about this thing that if you are saying that I'm not going, if you are not saying that pregnancy test in the female and agenda is there, so please be careful in the female. Always ask about LMP, ask about and do rule out. Okay, patient is 3 weeks now. She say,
Yeah,
doctor,
she will say I'm not
I'm not
pregnant, so
pregnant,
still,
I'm not
yeah,
trying, but
still,
still you have to
yeah,
go for it.
still,
Okay,
yeah, yes.
and renal function at least annually and more often in the elderly for those with the CKD and review the adherence, side effects, bleeding, or anemia symptoms. Okay.
Okay.
But with warfarin, doctor, we have to monitor INR
INR,
and
two
we
to
have to
three.
keep the target range and duration. And we have to tell the patient there is interaction with the diet and other drugs and alcohol also.
Okay.
In special situation, doctor, might come case the doctor that cases that arise in exam. Patient is a cancer associated
Then also
thrombosis.
we will
Okay.
give 6 months, no?
Yes, doctor. We will be giving 6 months. Pregnant lady with a
Pregnant
DVT
lady, yeah,
and
but we usually warfarin is not indicated
low
in the
molecular
pregnancy,
low
but low
molecular
molecular
weight
weight
heparin.
heparin we can give.
Yes. Okay.
And
And
breastfeeding we
prophylaxis of
can give
choice.
warfarin, right?
Yes. Yes, okay. And if like say patient is a pregnant and breastfeeding, require urgent obstetrician or hematology input. Shared plan with the peripartum management. Please make sure. Okay.
Okay.
Patient just delivered the baby 30 days or 40 days. She is a peripartum. Huh? So
So
you have to
involve
take
the
care of that.
obstetrician.
Yes, this is a sixth scenario I'm giving you. Seventh
Okay.
scenario
Got
is
it.
upper limb or a line related DVT. Okay, management like say line related DVT. Okay,
So
management is
sorry, doctor.
brought
What upper limb or
upper limb or line related DVT. For example, patient
line,
got
IV line?
yes, line
Okay.
related
Okay.
DVT. Okay, patient said, doctor, I was admitted in the hospital. I don't know, doctor, what happened to my limb.
Oh,
Okay,
okay.
so yes, doctor, this is a scenario. Number
Okay.
8 scenario will be coming as a post-thrombotic syndrome and follow-up.
Okay.
Okay, here you're going to advise early mobilization once anticoagulated and adequate analgesia if patient having the pain.
Pain.
Okay, classically compression stocking were used to reduce the post-thrombotic syndrome, but routine use is now more selective, doctor. So don't emphasize on compression stocking
Because
usage.
compression stocking, doctor, we have to do ABPI also, right?
Yes, doctor.
Okay. Okay. Thank you.
Okay, yes, doctor. So there are so many things out there. Here it is not one thing. We are going to make it. There are many things are there to rule out. Okay, so you can see one case,
So, doctor,
one.
for example, sorry to interrupt you. For example, one patient came, he will tell, I have swelling of, as you said, that swelling and pain of the calf muscles. Okay. Then he will say that it started like 1 week ago. Now, doctor, I feel the shortness of breath as well and chest pain. So it will be mostly DVT with pulmonary embolism, right? It
Yes,
can come.
doctor.
It can come, right?
It can. Okay. So like say if you're suspecting any DVT case, doctor, four things you should not miss. Okay.
Travel
Female is
history,
the LMP, pregnant
contraceptive
lady,
use.
breastfeeding, contraception, travel history, obese is there. You have to see the immobility. Obesity will not be shown over there. SP is sitting in front of you very thin, but outside it is written. Outside
Yeah.
written BMI is 35. So you have to keep that BMI 35 in your mind
In your
rather
mind.
than thinking about that SP sitting in front of you. So there are many things are there. This is we call distraction.
Distraction. Okay. Okay.
Okay, so okay, I was talking about this thing. So now, before that, after you, Dr. Maida is here.
Yes, doctor.
Okay, Dr. Maida, I have first interaction with you, I think so. Let's see how it goes. Dr. Maida, you have the patient, Mr. Ibrahim, 64 years old gentleman, come to discuss his problem with you and take proper history examination and manage the patient, okay?
Okay.
Okay,
Hi,
give
good
me 1
afternoon.
minute, doctor.
Okay.
Okay, start, doctor.
Hi, good afternoon, Mr. Ibrahim. My name is Dr. Maida. How can I help you today?
Doctor, I'm keep getting this pain in my calves when I walk. I'm having to, I have to stop all the time, doctor.
Okay, Mr. Ibrahim. I can feel it must be quite painful for you. May I ask few more questions about your
Sure, doctor.
complaint? Are you
Please.
comfortable?
Yes, doctor.
Okay, Mr. Ibrahim, can you tell me more about your pain that it's been, how long it has been started?
Doctor, I'm getting this pain on walking about 9 to 12 months now. It is gradually worsening.
Okay, and it was gradual in onset.
Yes, doctor.
Okay, and for how long you can walk comfortably, and when you have to take rest?
Doctor, about 100 meters, maybe 150, doctor. I'm not sure, but I can say that this is just about from my house to my shop.
Okay, and is this pain in both of your legs?
Yes, doctor.
Okay, and can you tell me which part of leg, below or above knees?
My calves, doctor.
Calf muscle. Okay, and do you feel any radiation of pain, or it remains only in calf?
Doctor, mostly in the calf and
Okay.
goes especially in the calf and thigh. That's it.
Thigh. Okay. How intense is this pain? If I will rank from 1 to 10, how much is this pain?
Doctor, it's like say when I'm walking, it goes up to 7 or maybe
Mm.
8, but
Mhm.
I'm resting, it's fine.
Okay. And Mr. Ibrahim, any relieving factor when you feel okay?
Doctor, when I'm stopping walk, then it stop.
Okay. And any aggravating factor other than
When I
walk?
walk, no, that's it,
Oh.
doctor.
So it means you're at rest, you are okay.
Yes, doctor.
Okay. And may I know that are you taking any medication?
Doctor, you mean to say medicine for what, doctor?
Yeah, for this pain, have you consulted any doctor or you took some medication?
Doctor, I'm taking this paracetamol tablet.
And it makes your pain better?
Yes, doctor.
Okay. Um, may I know that if you notice any leg swelling?
No, doctor.
Okay. Any redness?
No, doctor.
Any fever along
No,
with this
doctor.
pain? Any
No,
history
doctor.
of any history of trauma?
No, doctor.
Okay. Did you travel or you took a long flight recently?
No, doctor.
Any surgery done
No, doctor.
or any other history of hospitalization?
No, doctor.
Okay. Do you have any chronic disease
What chronic, doctor?
uh, like diabetes, hypertension, or any chronic disease like, God forbid, like cancer?
Doctor, I'm having diabetes, I'm having high blood pressure, I'm having high cholesterol.
Okay. And are you on regular medication for these three diseases?
Doctor, it's been now 15 years. I'm taking this tablet Ramipril, I'm taking atorvastatin, and I'm taking metformin and tablet paracetamol for the pain.
Okay. Good. And are you in regular follow-up with your doctor for these diseases?
Yes, yes, doctor. I'm going to follow up for
Okay.
my doctors. Yes,
When you did your last follow-up and your blood tests?
doctor. It's been 6 months now.
Sorry, I didn't get you.
6 months.
6 months. And your blood pressure and cholesterol and diabetes were under control?
Yes, doctor. It's well controlled, doctor, with the medications.
Okay, good to know that. May I know that about your family? You have any family history of same thing like leg pains or diabetes, hypertension, cholesterol in your family also?
Doctor, my father had a heart attack when he was 58.
Okay. And how is doing now?
He's no more, doctor.
Oh, I'm sorry to know about that. Okay. I want to know about your personal history. Are you married
Yes, doctor. I'm married.
and you are living with?
My wife.
Okay. And you have children as well?
Yes, doctor.
Okay. Your relationship with your family?
It's good, doctor.
Okay. Good to know. And what are you doing for your living?
Doctor, I'm retired postmaster.
Okay. Um, hmm. So what are you doing nowadays? How you are spending your whole day, your routine in?
Doctor, I just opened my small shop, grocery shop on the corner of my street. That's it,
Mhm.
doctor.
Okay. So you go by walk to your shop.
Yes, doctor.
Okay. So any financial issue?
No, doctor.
Okay. Any stresses in life?
No, doctor.
Okay. May I know about your dietary habits? What kind of diet you usually eat?
Doctor, I'm taking home food.
Good. May I know your height and body weight?
Doctor, my BMI is 27.
Okay. Are you comfortable in sleeping? I mean, your sleep is okay, or you are uncomfortable while sleep as well?
Doctor, I'm feeling comfortable.
Okay, so your leg pain doesn't bother you during sleep.
No, doctor.
Okay. Mr. Ibrahim, I would like to know that what do you think? What's going on with you?
I think, doctor, maybe some circulation problem.
Okay. And how it's impacting your life, daily life?
Doctor, I can't walk to my shop.
Hmm, I can understand. And what do you expect from today's consultation?
I just want to do some blood test or some ultrasound of my leg.
Sure, we will talk about it. Um, and what is anything which is concerning for you today?
Doctor, I might lose my leg. Maybe I need amputation.
No, I don't think so. It will like that. We will talk in detail. Mr. Ibrahim, may I know that if you are smoking,
Doctor, I do smoke.
how many cigarettes per day?
Doctor, 20 cigarettes.
And it's been how many years now?
It's been 8 years now, doctor.
Okay. And do you consume alcohol as well?
No, doctor.
Good. And any other recreational drugs?
No, doctor.
Okay, good to know that. Mr. Ibrahim, I forgot to ask a question. While walking, you told me about 100 meter, you feel pain. Is it like that that you feel better while going uphill or bending forward?
No, doctor, it get worse.
It get worse. Okay. And did you ever felt that your limbs, your legs become pale or numbness?
No, doctor.
Okay. Mr. Ahmed, sorry, Mr. Ibrahim, what I came, I would like to summarize your case that you have been complaining of calf muscles pain. It's been since 9 to 12 months, and now it's bothering your life. You cannot walk more than 100 meter. You have to rest because it really bothers you. After rest, you feel comfortable. And you are diagnosed case of hypertension, diabetes, and hypercholesteremia, and you have been taking your medication regularly, and these things are under control. Um, 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 am I right, or you want to add something?
No, that's it, doctor.
Okay, Mr. Ibrahim, would you allow me to have a quick examination for you?
Sure, doctor.
Okay, thank you. Mr. Ibrahim, I will sanitize my hand and under complete privacy, I will I will check your pulse, temperature, and blood pressure, and I will check your, I will do your general physical examination. I will check your hands. I will check the capillary refill. I will check your muscles wasting and anemia, jaundice, and then I will check your lower limbs. Especially, I will ask you to please expose your legs till your mid thigh. I will check the circumference. So I will inspect any redness, any change in the symmetry of muscles, and I will
Time up. Dr. Maeda, uh, history is wonderful, but you took almost 8 minutes plus in the history taking, which is you have to cut down, you have to speed up the thing, and you asked each and everything. Now, let me tell you, whenever you are taking the history, if like say patient diagnosis are there, so you don't ask about close question. So here you ask about the close question. So, doctor, I keep on getting the pain in my calves when I walk, and I'm having I have to stop all the time. Can you tell me more about it? Now, here, if you say, "Can me tell me more about it?" Patient will give you most of the history. Okay, so you have to ask whatever left over now. That's the reason it was time consuming for you during that history taking in HOPI itself, huh? Followed by your history was upside down. Just make it in more way. Patient had a pain. So pain means like say you have to ask about duration, site, character, time and pattern, and aggravating factor and relieving factors. Am I right? And moreover, limbs effect factors, you ask everything you asked, which is not required. Just ask one or two things: ulceration or non-healing wounds are there, no color changes are there, in numbness. Okay, you are asking about the pain at the rest. Pain need to go for dangle leg over the side of the bed, whatever, so on. So there are so many things. If you're asking, it will be more time consuming. Okay, here the aim to for the OSCE exam, so we have to make sure we should know the time management. Okay, now for the core goals of this patient, what you call it for in the management, to reduce the cardiovascular risk in like say MI, stroke, and death. Okay, and improve walking distance and quality of life, and prevent limb-threatening ischemia and amputation. Okay. Always remember, doctor, for everyone, we have to understand PAD is essentially a marker of systemic atherosclerosis. Okay, it's not as simply that it's a limb problem. So now we have to talk about lifestyle and risk factor modification. So there are important things that if patient is smoking, so we have to go for the smoking cessation plan because this is a absolutely key, strongly advised complete cessation. Okay, after pharmacological support, wherever it is appropriate for you to start NRT, whatever so on. In that case, in your exam level, you can say, I'm giving you this leaflet, Mr. Ibrahim, and take this leaflet. And whenever you feel comfortable, you can come back to me. It will be more feasible if you are wanted to make this event as a memorable. So, if like say your birthday is coming up, if your child birthday is there, your wife birthday is there, your marriage anniversary is there, or your some first day of job you started that day you want to make it memorable. So, we will be starting on that day, and you have to come back to me with your clear agenda, how you're going to stop it and what you're going to do it. Okay. And then second is exercise. Encourage regular walking. For example, walking near to maximal pain. Okay. Resting, then repeating at least 3 times per week. One. Number two, supervise exercise programs. You can refer for our patient for wherever it is possible to send. Okay. Weight, diet, and alcohol. Weight reduction if patient is overweight or obese, and heart healthy diet like say Mediterranean style diet, low in saturated fat, plenty of vegetables, whole grains, lean protein, and olive oil. You can say Mediterranean diet, it's fair enough. Okay. Moderate alcohol intake at most and avoid excess. Patient is taking lot of alcohol, you have to advise for alcohol reduction. Now, medication part is antiplatelet therapy for systemic, for symptomatic, like say intermittent claudication, previous revascularization, or critical limb ischemia. Single antiplatelet therapy for long term, unless this is contraindicated. Typically, we are starting as a clopidogrel is preferred first line in many guidelines. But again, I will strictly tell you not to follow anything whatever local guidelines says, and local guidelines in MRCGP South Asia they are following mostly the sign and nice guidelines. Okay, so you have to follow those, and aspirin is an alternative if clopidogrel is not suitable. Okay, and if you're thinking about dual antiplatelet therapy, usually reserved for the specific post-intervention situation, for example, after stenting or bypass, and it will be guided by the surgery or cardiology or vascular team, not by us. Okay. Then lipid lowering, patient is already taking, but we have to aim for the substantial LDL reduction, often more than 50%, and LDL below the guideline specific target in secondary prevention. Okay. Consider ezetimibe if like say patient having resistant. Okay, patient is resistant to the medication like say statin, if you give in after 6 months also patient is unable to do it, so you can consider resistant 10 mg. And patient is taking glucose diabetic medication, so we have to aim for our target tight glycemic control, and consider SGLT2 inhibitors and GLP-1 receptor antagonist agonist in the line with the diabetes and cardiovascular guidelines. If like say you are talking about blood pressure management is more important here, then supervised exercise therapy. Okay, for the symptoms relief and functional improvement and pharmacological symptom relief, you may offer some sort of thing, but it is not as per your level. For that one, you have to refer to the specialist. So when to refer, important thing here, when you're suspecting critical limbic ischemia, like say patient pain, feeling the pain at the rest pain in the foot, especially at the night, relieved by dangling leg. Okay, patient will be saying, "Oh, doctor, when I'm moving my leg, I'm feeling relief." Okay, non-healing ulcers or gangrene, or marked pallor or cool limb absent pulses and possibly reduced capillary refill. Okay, neoacute limb ischemia, sudden severe pain, pallor and pulselessness, and paralysis, paresthesia, and cold limb. Routine vascular referral you can send for the patient if you are considering um, a patient having lifestyle limiting claudication despite of at least 3 months of optimized conservative management. Okay, like say risk factor control plus exercise you have done, but is still not improving. Patient having significant reduction in walking distance that affects the work or daily living in this patient, and patient is otherwise fit for possible intervention. Okay, diagnosis uncertain, you can refer the patient. So if like say you given the diagnosis, but again you are referring this patient, it will be clear pass scenario. It will not be fail. Okay. When to do what to do in GP setting. Okay. Optimize risk factors, smoking, blood pressure, diabetes, and lipid control, and start platelet and statin as per the protocol, as per the local guidelines, unless contraindicated. Okay, and we have to provide patient information about food care, especially in a diabetic patient. Okay, so in the summary, what you can say, practical summary for as a GP, what you can do it, doctor. First of all, confirm the diagnosis clinically and with ABPI or arterial duplex if there is. If patient come with arterial duplex, then you can confirm. Start or ensure the patient single antiplatelet, usually clopidogrel, high intensity statin, good blood pressure and glycemic control, aggressive smoking cessation support, exercise program. Ideally, we are sending for supervised exercise programs. Okay, safety netting you can give, and consider routine vascular referral if symptoms remain the same after changing the lifestyle at least for 3 months. Then we have to send the patients. Okay. And doctor, I'll be taking break because I have to run one more meeting. So I have be taking off from you guys. I have left one topic here. I'll be joining this topic by tomorrow. Just with the other topics like say day 6 topics in cope and risk with varicose veins. Okay. So inshallah tomorrow for you guys it will be 8 p.m. time Pakistan time, and for April candidate there will be a time for 3 p.m. Pakistan time. So I'll be running for that February
For
candidates.
Saudi,
Okay.
Dr. Imran, for Saudi Arabia, which time? 1 o'clock and
And doctor, it will be 1 o'clock, I think so. Yes.
okay, okay.
Okay.
Thank you.
So thank you very much for joining, doctor. It was really nice to see you guys because I was not interacting with you guys, but soon we will be interacting once we will complete our February candidates. Then we will be getting. Okay. Thank you very much, doctors, and wish you all the best for the February candidates.
Thank you, sir.
Thank you, doctors.
Thank you, sir.
Thank you, doctors. Thank you. Night.